Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. As you probably know, when someone is eligible for Medicare and they're ready to take their Medicare benefits, there's only two types of insurance that are available. One of those types of insurance would be a supplemental plan that supplements original Medicare. The other one is called an Advantage plan or a replacement plan. And when you go on Medicare, you have to choose one or the other. Now, half of all Americans are on supplemental plans and half are on Advantage plans. So one is not better than the other, they're just different. And today's topic is I want to address 3 disadvantages of Advantage plans. Now, there are a lot of advantages to Advantage plans, namely 2. I'll tell you about the disadvantages here in just a second. But first off, why do people like Advantage plans today? Well, number one, they like them because of the monthly premiums are very, very low. In fact, on the high side, someone may pay maybe $49 a month for an Advantage plan, but normally it's more on the low side here, either 0 or very low premium. So that's a nice feature. The other reason people like Advantage plan is because all the perks that they throw in that are typically not available with the supplemental plan. Those perks would be things like dental benefits, okay? Vision benefits. Also, sometimes the plans throw in some hearing benefits, maybe even hearing aids, and then also gym memberships called Silver Sneakers. And so these are very nice perks. And so when people look at Advantage plans, sometimes they're very attracted to these particular aspects of their Advantage plan, okay? And so they buy an Advantage plan primarily for that, especially if they're healthy. And so these are great perks, but we also want you to understand there's also some things that are on the negative side of Advantage plans. Not trying to frighten you from them, not trying to steer you away from them, but you need to be aware of these disadvantages because many times agents aren't honest about these particular disadvantages. So let's go through these disadvantages. Number one will be networks. If you decide to get a supplemental plan, you have no networks. Medicare is your network. Any provider that takes Medicare, you can go to that provider, any hospital, doc, or specialist, okay? But when it comes to an Advantage plan, you will always have networks. There are 2 types of networks, HMOs and PPOs. HMO networks are typically a little smaller than PPOs. HMOs have certain restrictions that PPOs may not, such as referrals required and you can't go out of the network. But anytime you have an Advantage plan, you have to make sure that your providers are going to be in the network, that you can go to the doctor that you choose, or the specialist that you choose, or the hospital that you choose. Now listen, there's no doctor or hospital or specialist that's going to take all of these plans at all. Some will take an HMO, some will take a PPO, and sometimes they'll take both. But you got to make sure your providers are within the network because you have these network restrictions. The second disadvantage would be pre-certifications. Pre-certification, what's that mean? That means that the doctor has ordered an MRI or maybe a CAT scan or maybe is saying that you need a hip replacement or knee replacement, and that is going to have to be pre-certified. Now, every service that you have on the Advantage plan does not have to be pre-certified. You can go to your primary care doctor, you can go to a specialist, there's lots of things you can do without a pre-cert. But there are sometimes a pre-certification will be required on your Advantage plan. Now, if you stay in original Medicare with the supplemental plan, there's never a pre-certification. Medicare and your doctor make all the rules. Your doctor has a final say-so. When you have an Advantage plan on certain services, your doctor does not have the final say-so. If doc is suggesting something that requires a pre-certification, they're going to have to call the Advantage company and they're going to have to get that pre-approved. Just recently, we had a lady that was needing a hip replacement. Total hip replacement is what doctor suggested. She was on Advantage plan and the Advantage plan said, no, we're not going to pay for a full hip replacement. You can use a rod instead. We had a lady recently who was also needing hip replacement. Advantage plan said you must go to therapy for 9 months. After that, if you still need a hip replacement, then we'll discuss that. Had someone, again recently, needed an MRI on his back, has chronic back pain. They couldn't figure out what it is, orders the MRI. And the Advantage plan said, no, go to therapy 3 weeks, call us back after that. And so the whole point is they have a say-so in your health care. It's not just your doctor that make the final decisions. The plan also has some say-so in what is going to happen with your health care. Okay, and some people are just annoyed by that. And so you need to be aware of that. And then lastly, switching plans. Now every year, Medicare has an open enrollment period. This is October 15th to December 7th. And many people think because we have this open enrollment period that folks can switch plans and change and just do whatever they want without any rules. And that's not true. If you're on an Advantage plan, and let's say that you would like to switch to a supplemental plan and get off of that Advantage plan, Do you realize, folks, that after you have been on an Advantage plan 1 year, anytime after 1 year, if you want to make that switch, you have to be approved by that insurance company to make the switch. Okay, meaning you're going to have to go through underwriting. The insurance company is going to ask you 20 to 25 health questions. They're going to check your medications to see what you're being treated for. And they're also going to possibly get a statement from your doctor. We call it an attending physician statement. So you may have to get that statement from your doc. And so the whole point is an underwriter is going to have to approve you to make that switch. So many people think they can just switch and do whatever they want. But after you've been on Advantage plan 1 year to make the switch to a supplemental plan, you'll have to medically qualify. So these are some features that you have to live with. Yes, there's some nice perks and the premiums are very low, but you also have to be comfortable with these situations as well if you decide to choose a Medicare Advantage plan for your coverage. Thanks so much for watching. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.